Welcome to ZBTR TV.
The goal is to unearth and document the Zambian narrative in the best way possible.
Catch us live every Saturday on Facebook and YouTube.
We broadcast every Saturday at 10 a.m. EST, 7 a.m. PT.
With a growing audience across the globe, we connect Zambians and share resources abroad.
Be part of our journey. Please don't forget to subscribe to our YouTube channel.
With a growing audience across the globe, we connect Zambians and share resources abroad.
The ZBTR TV show.
Did you know? Less than 10% of our viewers are subscribed. Don't miss out. Be part of the community. Mark your calendars. Every Saturday, 9 a.m. Central Standard Time and 10 a.m. Eastern Standard Time. Flow live.
Welcome to the show.
Hello, everybody. Good morning from Dallas, Texas. It's sunny and it's like hot, like it's supposed to be in Texas. And I always like to make the joke that out here we are on fire for Jesus. That's how we do it. It's hot, it's hot, it's hot, it's hot, it's hot. Good morning and thank you for joining us. Tell a friend ZBTR is live and tag them, and please do follow us. We have a great conversation for you today. We're talking about health care and the diaspora. So those of you that are joining us for the first time, we are ZBTR TV, Facebook, YouTube, and on X, which used to be Twitter before. So tag a friend and let them know that we are live. We have a very serious conversation today. And I will go ahead and introduce my guests. The first one I'm going to go to here. I have a team of amazing ladies here who are doing some amazing work and wonderful things. I hope you are ready for this healthcare conversation, and we are ready to go. All right, joining us today is, well, my computer seems to be acting up. Dr. Agnes Kasolo. She's an internal medicine specialist and also co-founder of Alpha One Medical Consultants. Dr. Kasolo, good morning. Welcome.
Good morning. Thank you for having me.
Excellent. And also joining us is Dr. Cleopatra Thurma. Did I say that right?
You said it perfectly.
Okay, excellent. You know, this Mufulira accent has got its own challenges. Dr. Thurma is a vascular neurologist consultant, and she's also a co-founder of Alpha One Medical Consultant, and she's also going to be part of this discussion. Thank you for joining us. And one and only who's not a stranger, I think I need to make Dr. Anna as our correspondent on medical stuff on this show. Dr. Anna, how are you? Good morning.
Good morning. Thank you for having us.
Thank you. Welcome. Dr. Anna is also a vascular neurologist. She's an entrepreneur. And as you all Zambians out there may know, she's also honorary consul of Zambia. She's based in Atlanta, Zambia. Welcome and good morning. Our discussion today is about healthcare, and it's one of the greatest challenges that as an African diaspora we face. It's one area where a lot of money is going to, and we send money for prescription medication when one of our relatives, friends gets admitted. And today we are going to explore how collaboration, innovation, and healthcare diplomacy and the African diaspora can help bridge this healthcare. Now, before we get very serious and begin to speak those medical terms and terminology, one thing I'm interested in is I want to find out how the three of you met. How did you connect? Can you remember the first time you met, and how did that happen? Dr. Who's gonna go first? Dr. Kasolo, how did you meet these ladies, these Zambian?
I'll start with Dr. Katema. Dr. Katema and I actually work for Tanner Medical Center.
Okay.
We've known each other for about 10 years now.
Okay.
We've been very close friends. We're business associates. I've met Dr. Thurman mostly on the phone and on camera. We have never actually met in person because she lives in a different state. Dr.
Okay.
Katema and I live in Georgia. Dr. Thurman.
Yeah, I didn't even ask where you're all based. I just went on blah, blah, blah. Dr. Thurman, as I come to you, first, where are you based?
I'm based in Tennessee, in Chattanooga, Tennessee.
Oh, Chattanooga, Tennessee. Okay. So how did you meet these two ladies?
So I think our mutual connection is Dr. Katema. And I met Dr. Katema through a mutual friend who, during a transition in my practice, came out to do some mentorship for me. And he was like, I know a Zambian physician who's also a DO and a vascular neurologist. And I say to him, that's not possible. The person must be from Zimbabwe or some other place. People get mixed up all the time. And he's like, no, I know what I'm talking about. I was born and raised in South Africa. I would not mix up Zambia and Zimbabwe. And so I said, okay, well, I want to meet this Zambian vascular neurologist. And I was just looking forward to letting him know, I told you she was Zimbabwean. And he said, you know, you have very similar personalities, and I think the two of you are going to get along just great. And so he connected us. And I think we texted for a very long time, and just meeting Dr. Katema has been inspirational. She's a wonderful human being. And it is through this friendship that I got to meet Dr. Kasolo. And the rest is history, and we're here today.
It's great when people say you are a great human being to your face. You know, it's a great thing, because us African people are very good at saying things in front of, let me not go there. Dr. Katema, how did you meet these two?
Yeah, it's just like Dave said. So actually with Dr. Kasolo, you forgot one part. So she started working for the hospital before I did.
Okay.
And so then I joined this hospital, and I didn't know too many people. It's in an area that's not very diverse. And so I'm going to this hospital. I just graduated, and then we're buying a home. No, actually, first we're looking for a home to rent. We didn't buy initially. And so when we're talking to the realtor, then he tells me about this woman who bought a beautiful house, and he takes me to the neighborhood to look at the homes in that neighborhood. And so then he mentioned her name. So now my task was, when I went to the hospital, I had to find who this person was. And so when we connected, and she told me this, when we connected, she was typical African. She's like, come home. And so she tells the realtor to say, oh, I invited her home. And the realtor is like,
just like that.
Just like
that. Yeah, that's the way we roll in Africa. Huh?
Yes.
Come home.
Yes, come home and let's do it. And, you know, Dr. Joash Lazarus introduced myself and Dr. Thurman. We talked on the phone, we connected, and it was like we knew each other forever. We've traveled abroad together, and it's been wonderful. Yeah. It's
home. Yeah. The theme of this conversation is bridging the care gap. And somebody watching this is like, okay, bridging. What are we bridging here? Let's try to break this down. So what does bridging the care gap, what are we talking about here, Dr. Kasolo?
So when Dr. Tim and I are talking, and I know you introduced me as internal medicine, I am internal medicine trained, but I specialize in acute care. I work as a hospitalist in Georgia. I'm from Uganda. So I have had a chance to work both here in the US and experience some work in healthcare in Uganda as well.
Okay.
The two places have similarities and they have differences. So what every patient wants, both in the US and in Uganda, Zambia, South Africa, anywhere in the world is they want compassion. They want someone who's knowledgeable. They want expertise, right? They want state-of-the-art care. They want to feel better. That's common all around. What you find that is different between the US and the rest of the world, and especially Africa, is you lack the expertise. You lack the infrastructure. You lack the technology, right? You lack the specialties, the people that come in. You lack the collaboration that we should have. So we find that much as people want the same things, people may have the same pathologies, the care is different depending on where you are geographically. And what Alpha 01 aims to do or wants to do is to bridge that gap. Make sure that your geographical location that does not dictate the quality of care that you get.
This thing keeps coming up, Dr. Thurman, expertise, care, and no one can say they haven't had an experience to do with healthcare differences between where we are and back home. It doesn't matter what home is for you, like Dr. Kasolo said. So let's zero into this, the issues that Dr. Kasolo has raised: expertise, collaboration, care. I know you've probably tried to do something out there. I won't mention the name of the country. And you got this attitude. I want you to dwell on these issues: expertise, collaboration, and care.
So I do think that for me, bridging the healthcare gap is truly about unlocking Africa's own potential. So when I was in medical school, I had an opportunity to go to Puerto Rico, which is really part of the United States, with a group that really focused on understanding the communities, their resources, and their needs, right? I think sometimes we go into places thinking that we know better than what the local community really knows, but they've been in the thick of things, right? Trying to improve healthcare. So I think for me, unlocking the healthcare gap is really about looking at Africa's own potential and how we can use it as its own greatest resource. One of the greatest lessons that I've learned over the years is that they are experts in Africa, and what the rest of the world can do is to support those experts and really build them up. As much as infrastructure may be important, really the key, I think, is building healthcare systems that are sustainable. And I think that that's the one thing that I've learned from being in the United States and how healthcare runs. It's not really about the building, it's how we bring all the different experts together to care for a patient. For example, if you think about a stroke patient and the number of experts or healthcare providers that patient encounters, you have the EMS that pick up the patient, and we train them to ensure that they can recognize a stroke, right? And if they can recognize a stroke in the community, they can alert the hospital to let them know that a stroke patient is coming in. This mobilizes the hospital to respond to this patient's acute needs. When the patient hits the emergency department, they're seen by an emergency medicine physician, they are seen by a neurologist, they get their acute care. After that, they're cared for by a critical care physician, perhaps, or in a stroke unit, and they're cared for by nurses, physical therapists. When all of this is done and they're ready to transition out of the hospital, they have rehab physicians. So it's about all of these people and the infrastructure that has been put in place to support the patient that ultimately we're able to give this patient back to their family. So I think that looking at the resources, I think we in the diaspora have a lot actually also to learn from resource limited communities. How are they using these same resources to try and have the same outcome with the people in the diaspora and all the excess resources that we might think that we have, right? But I truly think that it's about building infrastructures and building those infrastructures around the resources that we have, being realistic.
Excellent. So, Dr. Katema, the three of you are co-founders of Alpha 01 Medical Consultants, and the purpose is to help sort of bridge this healthcare gap. I don't even know how you do this, because I know medical doctors, whether you are, you don't need to be a vascular neurologist to be crazy busy. You are an entrepreneur, you are honorary consul, that government thing has got its own. So what inspired you? What prompted the formation of this Alpha 01 medical consultant?
So I will tell you, so Alpha 01 for me is very deeply personal. And with the name Alpha 01, I would say how it came up driving down the road, and Alpha and Omega will always be number one in this company. And that is where Alpha 01 comes from.
Okay.
But when I was born in Zambia. I was in Zambia until the age of 18. At age 16, I lost my mother at UTH, and she died from a very bad hemorrhagic stroke. And at that time, Zambia did not have a neurologist to take care of her. She was taken care of by a cardiologist. They were going to fly her to South Africa, but the day before they could fly her to South Africa, that's when she died. And so when I went into medical school, I went back and forth between infectious disease and neurology. But I was always put to neurology because I believed needed to give back and help in Zambia as well. And there is something to say, and I could be wrong, but to my knowledge, Dr. Thurman and I are the two first Zambian trained vascular neurologists that we have. And I believe, Cleo, you can correct me, but I don't think we have any vascular neurologists in Zambia right now. And there is something that comes with being first in doing things. I believe God doesn't give you the first to do this just for you to be first to do something. There's a reason. And so that has been a push. And, we go on and talk to these ladies, we need to do something. Dr. Kasolo and I have been talking for a while, and we brought in Dr. Thurman. So that is kind of the backstory on Alpha 01.
Okay. So here is the challenge with us living in the diaspora, whether you're in the medical practitioner, whether you're an engineer, whichever field you are in, okay? How can specialists living abroad contribute meaningfully without relocating permanently? How can you do that, Dr. Thurman?
I think through collaboration, right? I think over the last decade, the way that information gets to us has really changed. And so we really need to capitalize on ensuring that we use the resources that we have available. For example, we're having this conversation. We can have conferences now via telemedicine to allow experts to exchange ideas. We can ensure that we engage in mentorship. This is something that I truly believe in, is taking other young neurologists that are in Zambia. Zambia is actually quite fortunate that they have a neurology residency program that was started there. And that in itself, an example of building an infrastructure and ensuring that we're empowering the people in Zambia to take care of Zambians. And so, and I think these type of collaborations are everywhere in Africa. I know of one in South Africa, and I know one in Nigeria. And so for us who are in the diaspora, it's about taking these opportunities now to ensure that we're mentoring other young physicians that are coming up in Africa, that they have the tools that they need to take care of our families in Zambia, right? We cannot do all of this on our own. Collaborating through medical education, most of us are at institutions that have residency programs, and we always see all these people coming from Europe and passing through our residency programs and how they enrich those programs. And we need to be offering those same opportunities to people, to other physicians in Africa, bringing them in to learn from experts just the same way that we have, so that they can go back to Africa and then be able to provide that same type of care to the people back home.
Dr. Kasolo, how does this look for Uganda, the mentorship thing, the collaboration? Let's talk about Uganda, because if we talk about Zambia, we'll be stoned, but I think you are safe talking.
Thank you for asking that question, actually. A couple of years ago, I joined an organization called the Uganda North American Medical Society.
Okay.
It's best both here in the US and in Canada.
Nice.
What this organization has been around for a very long time, and I joined them, and I currently serve as their community liaison, community director.
Mm-hmm.
And what we do, what they've done, and what I've joined them to do is they go to Uganda and do medical missions. But they've also realized that medical missions by themselves are not sustainable. And they're not alone, because it's a one-time thing, and then you go back again, there's no follow-up, there's nothing. So they have picked up residents and medical students that they mentor. To date, they've mentored a couple of neurosurgeons, they've mentored primary care doctors, they've mentored hospitalists. They're doing that. On top of that, every 2 years, they hold medical conferences. These conferences are held here in North America. The last one was in Toronto. The one next year is going to be here in Georgia. But those conferences have allowed participation of people from all around the world. So the last one that they had participation of people that were in Canada, people who go on medical missions, people who go teaching in Africa. They had people in Uganda participating and presenting during those conferences. That's one of the examples that Dr. Thurman is talking about, collaboration through research, through medical conferences, sharing knowledge. This organization doesn't just have doctors and nurses and medical personnel. It also has lawyers. It also has IT people, and they encourage skill sharing between people in the diaspora and people back home. So like Dr. Thurman was saying, one of the major things that you could do is share a skill. If you live in North America or on the Western world, in the diaspora, and you have a skill that you could teach to people back home, you don't need to move there permanently to teach them. You could go there during holidays and teach them. I know Dr. Katema comes to Zambia every now and then and teaches residents. That's one way that we could share knowledge, right? Give them something they don't have. We can use telemedicine now. We have WhatsApp that is wide open. People can record videos. People can openly share information, right? More and more African nations are getting into AI. AI is a tool that we can encourage people to use so they can learn to solve problems and share medical knowledge and all that stuff. So there's so much that is being done already. The problem, I think, that is happening with African nations is most of these things are being done in silos. Everyone is doing their own thing. What Alpha 01 wants to do is to bring people together so that when a solution a solution to a problem gets found in Uganda, this solution most likely can be applied to a country like Zambia, and we can share. If there's a problem here in North America, in the diaspora, that we share with a country in Africa, we can share the solution that we come up with here with people back home.
Doctor, how do we here's the problem I have, or the challenge that I have, or something that I wrestle with. We do too many conferences. How do we go beyond conferences, Dr. Katema? I mean, we have conferences for everything. How do these things translate into tangible things? Wow, that was a good word I used there, right?
Well, I mean, conference is one way of getting knowledge in one space. But when you leave that conference, like my colleagues have been talking here the whole time, is now what happens after the follow-up after the conference.
Exactly.
And so telemedicine is one thing that Zambia needs to embrace.
Explain what that is.
So what telemedicine is the technology that allows a physician anywhere in the world to be able to evaluate the patient who is in Zambia. And so, like, what we have been doing currently as Alpha 01 is we have been able to partner with Teledoctor Zambia. And with that, we have been able to actually have stroke clinics every month. And we have been able to evaluate patients in the clinics in Woodlands, Lusaka. And what that has looked like for us is we've partnered with neurologists on the ground as well, because we also have to respect the Zambian licensing laws. And then we also want to share that knowledge that everybody's talking about here, knowledge sharing. So we're working in partnership with the neurologists on the ground. We evaluate the patient, and there's knowledge exchange. We learn from them, they learn from us. The patient gets the care that they need. So it's been wonderful. And so Zambia having to embrace that is very key, because a lot of people have built their lives in the diaspora.
Yeah, it's true. Sorry to cut you short. You mentioned something there to do with navigating the licensing and the laws. Of course, the way things are done in the US and even Europe or England, to be specific, is different from how do you navigate the licensing aspect of it?
Yeah, so it's not easy. So right now we have temporary licenses that we've been practicing on. We were able to get temporary license. We had to apply. We sent our credentials.
So you had to be licensed in Zambia?
Correct.
Even in Uganda, I presume?
We will have to be licensed, yes.
Okay.
So we just and that's fair, because you don't want anyone to just see the patient, because you want to vet and make sure this patient is qualified and they really are who they're saying they are. And so our next step in Alpha now is going out to get the permanent licenses in Zambia, and we've had to engage a lawyer to start helping us with that. And that is the other thing that we are now asking the We've had a conversation with Ministry of Health, because there's a difference. So if somebody is doing telemedicine, the type of license that they'll require could be a little bit different than the license that somebody who is doing full-time on the ground should get. And so that's one of the things that we are hoping we can actually accomplish, is the ability to get telemedicine specific licenses, which are not as hard to get as an actual license if you're on the ground. I will give you an example. The state of Florida, they have done that to make it easier, because there's a shortage of physicians everywhere in the world. And so to allow that, they have made limited licenses for people who are just doing telemedicine, because your practice is narrowed. So that is what I'm hoping we can get to Zambia, because if they can do that, they will get a lot of specialists who will collaborate with universities, collaborate with hospitals, and they'll come into the country. They'll be Zambians, they can be from other countries, but ultimately it will help the patients.
Yeah, excellent. Okay.
I think, sorry, Nathan, I would also add that this way of practice really removes the geography of where we are and not having access to care. And this is not unique to Africa. For example, both me and Dr. Katema here in the United States also do telemedicine, right? There's plenty of hospitals in the outskirts in the United States that don't have the volume or the bandwidth to be able to employ a full-time neurologist, for example. And so therefore they use telemedicine for the cases that they have, 5 cases a month or something, that come in and have a neurologic problem and they need to see a neurologist. This is the way that we're expanding care everywhere, is by using technology. I think it is the one thing that the era of COVID really solidified, is that we can give good quality care regardless of where the patient is located. And therefore, I truly do think that this is something that Zambia truly needs to embrace and try to be a leader, ensuring that we can bring care to our families, to our friends, and remove this geographical barrier.
Dr. Kasolo, how is it working in Uganda?
So far, nobody that I know has embraced telemedicine in Uganda. When we had, and I know you talked about conferences and what happens after that and discussions, but one of our last conferences for the Uganda North American Society in Toronto, we had someone in Canada that, as you know, Canada also has issues with accessibility, as the US does, but I think Canada has more. But we had a physician come there to present how he is going to reach into the regions of the native, I think indigenous people over there using telemedicine from where he is, and how he was trying to show us how we could use this. We could incorporate this to use it in the third world countries in Uganda. So right now, our organization is considering using some of that. I know some of the surgeons from our organization that are teaching medical residents back home are already teaching them when they're best here. So they're not seeing patients, but they're doing a lot of teaching via technology. So that's some kind of, at least some kind of some way of bridging the gap and some way of reaching out. If we can translate that into seeing patients, I think we can make things work. I think we can improve healthcare that way.
The aspect of technology comes into play here in different more ways than we want to admit. We shall try to zero in into that when we come back. Let's take a little break here and we shall come back.
So girl Joyce, popularly known as Rejoice the portrait maker. Guess what? I am here to show the surprise, as I said during an interview, so that there is a surprise for Pastor Nathan Nkama that I will be reviewing in just a few days. So here is the portrait that I did for Pastor Nkama and his wife. Look at how beautiful this portrait is looking. And get to be with us as he also do the video with the portrait immediately when he received this portrait. Thank you for watching. So, girl.
Okay, I've been running that commercial. We decided to do a GoFundMe to help Joyce to buy our own commercial printer to make those portraits. The reason I decided to do that is because that girl is a school dropout, but she chose not to do the typical African thing of whatever. She started that business. So ZB Tiara is supporting Joyce to fundraise to buy her own printer. She also wants to employ other people. So everybody, the GoFund link, we'll put it in the comments. I would like you to help us help that young lady to raise money. That is what this is about, okay? Just like Alpha 1 is trying to do the medical thing, we are trying to help in a very small way, help people to build their own lives. Okay. Now, technology continues to transform healthcare. Those of us who live in the US, or I believe in any other Australia and other places, when you go for treatment, you can see how technologically the healthcare system is advanced. How do we envision ourselves, Dr. Thurman, to this question is, I'm even trying to find the right words. I'm trying to be careful because one thing that happens between us and our people back home is this: we are not trying to look down on our country. No, we're trying to help. Trust me, Dr. Kasolo is not trying to look down on Uganda. Nobody's trying to look down on anybody. My concern is how do we make these things happen? We have issues of load shedding, okay? I'm trying to avoid making political statements here to implicate my sisters, the innocent ladies who are just trying to practice their medicine. But I can run my mouth all over the place, but I'll stick to what we are talking about here. What can we do about this technology thing? What can we do? Dr. Taylor?
Well, I'm not going to talk about the load shedding because I'm probably not an expert on that subject. But technology definitely, I think, has a place in healthcare. And I think, sometimes it's taunted as, is this something that can replace healthcare just because people can look up things on their phone? Are they going to replace physicians? And I honestly do not think that that will ever happen, because you do have to understand the science to be able to explain it to your patient. But I think technology can empower healthcare professionals to be more efficient, right? We have, and to also provide a higher level of care. So I can give an example in the world of stroke, given that that is my specialty, is that we use AI to look at patients that are coming in with stroke and looking at what tissue is what tissue has died and what tissue is still healthy that we can save as we address taking care of a patient coming in with an acute stroke, right? And it allows us, from our understanding of medicine, we can look at the brain and say, hey, even if this person has lost this much brain tissue, it's sort of in the visual area, for example. But if we do nothing, they're also going to lose brain tissue in the motor area, and they're not going to be able to move their arm or their leg. This empowers me as a vascular neurologist to advocate for my patient in obtaining all of these acute therapies, right? So that's an example of how technology empowers me to take better care of my patient. And then, as we've already talked about as well, technology allows us to really take away the geography. Myself, Dr. Kasolo, Dr. Katema, we can see patients in Zambia and be able to offer them our expert opinion regarding stroke and stroke care. In doing that, we've also been able to collaborate with physicians in Zambia that have gone through the neurology residency program, but they didn't have perhaps the opportunity to also do additional training just specifically in stroke care. So we're collaborating. They're teaching us how things work in Zambia, what constraints they have, what barriers, and these are the things that we can take. For example, I work for a large organization, and we have smaller hospitals that are in rural areas. I learn from their strategies in caring for people in in a resource limited setting, to also take this to my institution and apply it in these resource limited areas in the United States. Whereas in before, I would have said, there's no solution. You have to get this expensive AI technology, right? But now I can be creative and innovative by learning from my partners in Zambia what they're doing with limited resources, and I can apply that in limited resource areas here in the United States. And so I truly do think that technology can level the playing field. Telemedicine truly can connect patients everywhere and anywhere with experts. And it's also very expensive. Like, it would cost me a lot of money to leave my home here in the United States, leave my children, leave my husband, to go to Zambia and give back, which is something that I'm truly passionate about. I think from the day that I decided I wanted to be a physician, part of that drive came from seeing people around me suffering and asking the question, how can I change things, right? How can I change things for my people? So I might not be able to travel to Zambia, but I can definitely help care for people in Zambia through telemedicine, right? It takes away the financial burden for me, but still allows me to continue practicing and caring for people in a way that is safe and just basically truly does remove this geography. I can't say that enough, right? And then even if we look at Zambia itself, the UTH is the hub, right, where all of these people have to come to get their care. Sometimes time is not with us in some of these pathologies, right? And so it's also, can the people that have gotten the education that they need, the neurologists that are mostly based in Lusaka and say the Copper Belt, right? How can they also expand their expertise to the rural areas in Zambia, right? So it's not just about, from diaspora to Zambia, it's from Zambia to the rural
areas.
Exactly. So that people don't have, it's costly to travel from Kasama or Serenge to go to UTH and get the care that you need. Can we still provide care for those people from UTH by utilizing telemedicine? So I think technology has truly a way of just just leveling the playing field,
Yeah,
allowing
it does.
regardless of where they are.
It
I
does.
couldn't do that enough.
Big time, big time. That's the website for the Alpha O1 Medical Consulting team, and that is their email for those of you who specialize in emails, and that where's their number, and this is their number. For those of us who are lazy to write emails, we want to text, and we want to, that number is WhatsApp friendly as well. And if you want to get in touch and see how you can get involved, get advice from our distinguished ladies here, how you can do your part in this. Dr. Katema, you wanted to say something?
I did. So to go back to your question, because this is something that I've experienced now working in Zambia through tele. So the good thing is, you know, with technology, understanding the community that you serve. And so when you build a platform, you have to build it in such a way that it's supported by the infrastructure that you have in that geography. So the telemedicine that's going into Africa, when you build it, you have to make sure that it's being supported by the phone, you know, like MTN, it'll be supported by Airtel. So that is one way to get around when we're talking about the, you know, the obvious, we're talking about the load shedding, we're talking about network. So it's going through those partnerships with those phone companies. But also one way for us has been partnering with the clinics, and the clinics do have internet. And so we've been fortunate that the internet has been stable, and the clinics are during the day. And so when we see the patients, at least we're sure that we're going to evaluate those patients.
Okay.
And because of understanding that challenge too, that's the other reason Alpha O1 is mostly partnering with clinics, hospitals, like really infrastructures where we know we can have stable internet before we start branching out. But there is a way. You have to find a workaround. There's going to be limitations everywhere you go. You just have to find a way to work around it.
Excellent. Okay. We have a lot of people watching, and they are also saying things here. Good morning. Been waiting for this one. That's Zenith. Dr. Kaingu says, good morning. Watching from Indiana. Clotilda, good morning, family. Matilda is watching from Kansas City. And there was a question asked here, which I want to show. Okay, what's this? There's a lot of to bridge and love. What are these three women doing? Okay, Dr. Musoma has asked a question. All right, there it is. How do you mitigate diaspora savior mentality?
Yeah.
Whatever that means, Dr. Musoma also. Maybe you his fellow doctors understand what he's asking.
And you know, so it's interesting.
Yeah, it is.
And you know, and that's why when we started this, and it's actually embedded in our practice model. So here's what's been happening for the longest. And I think any physician that you are going to meet, or any healthcare worker, or any specialty, in fact, let me not talk about any profession. When you leave the diaspora and you go to a developing nation, a lot of times we want to push our ideas on them.
Okay.
And so when we do that, there's resentment from the other side, because then it's almost like we think we're better. I know better, so you should do things my way. And we're very careful. So one of the things that Alpha O1 will not do is we're not there to replace the physicians who are in Zambia. We're very clear about the fact that we want to collaborate with the physicians who are in Zambia. We're very clear about the fact that we want to exchange knowledge. I know some things, they know some things, and we can exchange. And I feel like that's how you mitigate that. I'm not there to save them. I'm there to share what we've seen work and we think can work. And if they're open, let's work together and make this thing work as partners. So we are not going in there to say, oh, we know things, this is going to work, so do it our way. That is not how Alpha O1 works. We're partnerships with the neurologists in Zambia, with primary care doctors in Zambia on the ground. We educate, they educate, we see the patients, we co-manage the patient. The important thing that we know is those patients will always belong to them. We are just simply bringing in that expertise that we're sharing, we're learning. I've learned something. I will last when was our last clinic? I think was it last week or the week?
July 4th, I think.
July 4th, we had a stroke clinic. And so we saw patients, and one of the patients, beautiful images that came up, and we're reviewing these images with the doctor there. It was one that I haven't popularly seen here. So it was good. I learned something. We talked about it. So it's sharing knowledge. I'm not better than them. I've just been exposed to more technology and we're just sharing. So I think that is one way to mitigate. Remember that we are not better than them. We're colleagues, number one.
I like the word you used, co-manage.
Yes.
Co-manage.
And one of the interesting things actually is during that clinic, some medical students actually joined the clinic, which was like beautiful. Some residents. Oh yeah, sorry, I wasn't at that clinic, but she shared this with me, and I was just super excited because I'm a program director for neurology residency here in the United States. And so to hear that these residents had actually joined clinic, like that truly, I think, speaks volumes to this mentorship that we're talking about, right? So the Zambian neurologist, he brought his interns to the clinic to also learn, right? We in the diaspora cannot do everything. We cannot save the world. That is not possible. However, we can pick projects that we want to be a part of. And I think anytime, for example, I was trained by somebody. Because I was trained by somebody, every patient that I touch, to some extent, is tribute to the physician that they helped me become. And that's what these collaborations, mentorships are all about, right? Is that we want to have a ripple effect. We've been given an opportunity. We want to take that opportunity and expand its impact in the world by collaborating with those that are in Zambia to help them understand, like, hey, these are the things that we've learned and that we've done. How do you see any of this translating into your environment? And if they think that that information can be useful, understanding the landscape that they live in, they take that knowledge and expand it, right? During those collaborations, we're also like, whoa, look at this and what they are doing. And, we might come back and say, does every stroke patient really need to be in a critical care unit? Maybe not. We can have stroke units. These patients are doing amazing in these resource limited areas by practicing this way. How can we take this and also cater it to the environment that we're in? It's absolutely about collaboration. It's not about one being better than the other. It is a two-way street. 100%. I agree with Dr.
I have a question for Dr. Kasolo, but let me put some comments here. Katie says, very well articulated. And imagine being able to be seen, to see patients for preventative primary care via tele. It would reduce the number of sympathetic PTS seeking care at the hospitals. That's it. I know. She's also in the medical field, so you ladies understand whatever. Zenith, you're making some of us look like grade 7s here. Ladies, you are doing a great thing for the people back home. These ideas will change the face of healthcare. Another comment here. Yes, some countries have big medical associations here that help back home. So this is a beautiful start. It can be done. Dr. Kasolo, so how do these clinics that you hold work? Somebody watching this from Zambia, Uganda, South Africa, they say, I want to be, that's why I've kept the number there so people can get in touch. how can anybody participate?
So if we're talking about Uganda, Alpha 01 has not, we haven't started on Uganda yet. We are trying to use the, what I talked about earlier, that because we do share, for the most part, we do share similar problems, solutions that we come up with in Zambia could be used through collaboration, could be incorporated and used to solve problems back in Uganda. So right now we're only working in Zambia. My experience, right, as far as Alpha 01 is concerned, but as far as Uganda North American Society is concerned, that I work for, and I'm not here to promote them, but I'm saying because that's so far what we're using back in Uganda. That's my experience for now in Uganda. So far, what we do go on medical missions. The doctors that do mentorship and the doctors that do the training of the medical residents and the medical students do everything virtually during their free time. Every time someone has a vacation, they go there and they work with a hospital, just like Dr. Katema does when she goes to Zambia. They work with a local hospital to help with some of the medical residents and students that may need help, and some primary care doctors that also need help. But I want to go back to the diaspora savior mentality question. I think it also goes both ways. Much as specialists could come in thinking that they know everything, sometimes you do encounter local people or local practitioners that think or have an expectation that this diaspora specialist, be it medical care, be it in law, be it in education, is bringing everything and they're coming to give me everything. And I think to just piggyback off of what my colleagues have said, the key here is for us to emphasize and to realize and to tell everybody that you know your environment. You probably know, much as we grew up there, we were born there, we grew up there for the most part, for a little part, you know that environment better than we do. And I did experience this when I went to Uganda the last time UNAM had a medical mission, talking about just treating people hypertension and diabetes, and the same medications that I would prescribe here in the US may not be the same medications that people there have access to. They're just not it's not just cost effective to use over there. So I'm using my local colleagues over there to help me tell me what medications are going to be most cost effective for people back home. I know we are doing that for the stroke clinic right now. We are collaborating with pharmacies, and the clinics that we collaborate with, we are asking them the prices of these medications. Much as we may come contributing to some expertise as far as treatment is concerned, we are relying on the pharmacists to tell us what's cost effective for some of these patients.
Okay.
Yeah. I think if we're not open to this collaboration and we constantly think that people in the diaspora have a God complex, we're going to continue to push out expert help that is trying to come into Zambia. I think we need to find ways to embrace the diaspora. In India, for example, I would give an example that a lot of people in Zambia send their loved ones to India for expert treatment, right? Because it's accessible. What India has done is that those people that actually learn in the diaspora go back home to India to take that expertise. And now India has become this hub of medical care, right? So if we are closed and we push out the Zambian diaspora that has gone overseas to collect this expertise, we're never going to grow as a nation. So we need to embrace one another and say, hey, how can we make things better for our people? And I truly think that for myself, Dr. Katema, Dr. Kasolo, this is what we are trying to do. This is what bridging this healthcare gap means to us. It's empowering our co-physicians in Zambia, collaborating so that people don't have to travel to India. People don't have to travel to South Africa. People need to be able to get care in Zambia. That is important. We cannot do that if we don't build each other up.
Exactly. You mentioned India, and that was going to be my next question, Dr. Katema. Medical, what do you call it? Healthcare diplomacy has become a big thing. What does successful healthcare diplomacy look like in practice? I mean, let's try to relate it to Zambia especially. How can this work? How does it look like in practice?
Well, I mean, healthcare diplomacy is essentially getting two nations that collaborate beyond politics So you have partnerships between hospitals, you have partnerships with universities, clinics from 2 different countries, and then they're collaborating. So kind of what Alpha O1 is doing, part of that, this is healthcare diplomacy. This is medical tourism in a sense, where you have a company in the US that's partnering. We have MOUs signed with companies in Zambia. So essentially, that's what it is, getting 2 nations together. And even in Zambia, they send people to India. So you just don't randomly send people to go to this hospital. So those hospitals that they are sending people to are hospitals that they have agreements with, they have worked together with. So it's a system. You have to build a bigger system than just go to that hospital, go to that clinic. And so that's why Alpha O1 is important, because what we are coming to do is, with our physician expertise, we understand healthcare. So if I'm going to partner with a clinic, number one, I'm going to vet that clinic to say, what do you have? I'm going to try to understand the resources that you have. How are you treating patients before I will come to the diaspora? If they come to us and say, can you help us coordinate care for my mother? I will say, fine, we'll help you. These are some of our partners. We're not going to send you to one person only, because we don't want to be accused of favoring one particular person, because we don't get money just to send people to a clinic. That is not how we work. So we partner with different clinics, and we will tell a family, this is what these clinics can offer, and the family can choose. But a lot of it is just having that system in place that makes it easy to work between nations. And so what you will find with Alpha O1 is, it'll be easier for you to coordinate the care of your mother, your father, your siblings in Zambia if you use us, because we have vetted clinics, hospitals, pharmacies, home health care agencies that we have signed MOUs with. What I do get now is people will text me and say, sometimes I can't even read the prescription. What medicine is this? Where can I find it? They've been going to these 2 pharmacies and they can't find the medication. Or somebody will just send me pictures of, this is a CT scan of the head. What do you think? So now we're trying to put together a system. And so that is essentially healthcare diplomacy from the US to Zambia, the 2 nations working together.
Okay. Can Africa become a high quality healthcare primary source of outbound medical tourism?
Yes.
You agree, Dr. Kasolo? It can?
100%. 100%. Africa already has very trained, very skilled physicians and nurses and healthcare professionals. What we are lacking is a system to bring everything together. What we are lacking, we may be lacking some of the infrastructure, improving on our roads so that ambulances can easily travel between places, communication, as Dr. Thurman was talking about, EMS or ambulances coming to pick up someone from home, being able to send information to the emergency room. We may be lacking that now. And I know Africa is working towards that. Everyone is trying to get business governments to work on that. But we do have the people that have the skills. We need to invest more to increase that workforce. We need to find a way to retain the workforce, the people that we train, because you do have a bunch of people that get trained back home that end up leaving for different reasons. We need to find a way to retain them. We need to invest more in prevention. It's easier, it's cheaper to prevent a disease before it happens than it is for you to deal with complicated advanced diseases later. We need to collaborate more, accept the diaspora for the skills they bring in, learn, embrace technology. Embrace telemedicine, embrace AI. It's here to stay, it's here to teach us, It can help us be more efficient. It can help us practice, arrive to evidence-based diagnosis much faster than we did before.
Okay.
And we just need to learn to accept each other for what it is. Dr. Thurman was talking about, that accepting the fact that this person is not coming to tell me what to do. They are coming so that we can learn from each other, learn to exchange knowledge through the communication systems that we have. And then nobody wants to talk politics, but we do need to lobby our governments to help us.
You can't avoid politics.
You can't.
Yeah, you can't. Everything
right.
Like they say. There's also medical politics, right?
Politics.
Just like there's family politics. There's church politics.
For us, it starts with licensing. I mean, we're going through hoops to get all these licenses and the laws and the fees that are involved. There are laws when it comes to transporting medications, equipment from different parts of the world to bring into Africa. There are taxes that have to be paid. Yeah. So politics cannot be avoided.
True. So what can everybody watching, okay? What practical steps can every member of the diaspora take this year and help strengthen healthcare in Africa? What steps can we take? I'll start with Dr. Thurma.
I think that my advice would be take one simple step, okay? Mentor one medical student. Commit to one virtual lecture that you can give. Collaborate on a research project. Help develop one clinical guideline, right? So support one residency program. If you have a residency program in your country of origin, be part of the education system and collaborate with them. I think it is through these simple steps, something that is sustainable for you, that you can continually do all the time, that will have an overall ripple effect, right? We want to have a big impact by small movements that are sustainable. So that is my advice to everybody in the diaspora, is we should not be discouraged. I think some of us sometimes get discouraged, but we need to power through and push through. And then those our core physicians in Zambia, embrace the people in diaspora, pull them into your network, utilize them as a resource. Do not think of them as, whoever brought up this God complex. You opened a Pandora's box because this savior complex. You opened a Pandora's box because you don't know what is more frustrating than a Zambian physician coming to Zambia, attempting to help, and being made to feel like a foreigner in your own country. We already feel like a foreigner every day. There's many barriers we have to overcome to practice medicine where we are. When we come home, we want to feel embraced. We want people to say, hey, bring your knowledge. Thank you for coming home. How can we help you? Help us. How can we help you be part of this system? So I think it goes both ways, but take one simple project. Find a medical student that's interested in your subspecialty, mentor them and help bring them up. Every patient that they encounter throughout their lifetime, you will have had that impact. It's a ripple effect.
Dr. Kasolo?
So I'm going to talk from experience. For anyone in the diaspora that has a skill, and again, I'm appealing to doctors and nurses and physical therapists and nutritionists, but I'm also appealing to people that outside of the healthcare field. If you have a skill, we all at some point go back home to visit. We go home to have to party, to drink, to eat the local food. Think about what your community back home needs and see if whatever skill you possess here could be transferred to somebody there. See what you can teach someone there. It doesn't have to be someone in a hospital, right? It could just be just teaching the community. I'm internal medicine trained. Much as I practice in a hospital, I'm also capable of going to teach people about nutrition, about doing diabetes teaching. I can do about high blood pressure teaching. See what your community needs. See what your local clinics need. Visit a local clinic and see what they need. And I'm not talking about in terms of money. I'm talking about in terms of skills, and see if you can help. See if you can teach someone something.
True.
Dr. Hannah?
So for somebody in the diaspora, my lessons is because I've tried, I've gone, I have had had the opportunity to go and taught residents at UTH earlier in my training. And what I have come to learn through my association with Zambia is if you want to do something from the diaspora, if you want to do something anywhere, find out what the people need. Because what I think is an emergency is not necessarily the emergency. So look at it as right now, if somebody is hungry and they want mealie meal, and I go and talk to them about you need to invest your money and get life insurance, it's not going to make sense.
Yeah.
Because their immediate need is, I just want to eat. So when you go to a developing country, the number one thing that you want to figure out is what's the most important thing. Meet them there, start there, and then add on more that you have to offer. Don't try to push what they may not yet see because you're going to face resistance.
Yeah, that's very true. All right. Sharon says, bravo, Team Alpha One.
Thank you.
Thank you, Sharon.
You ladies, that's Dr. Kaingo. You ladies are performing outstandingly, and we are very proud of you. This is a women-led team. As a woman leader myself, I understand that there are instances where you may face challenges or be underestimated. How are you managing this dynamic, knowing that leadership positions are often predominantly held by men?
Yeah. We face that all the time, and it's interesting. So when you go to most boardrooms, we're usually triple minority. You're Black, you're foreign, you're woman. And
wow.
And you have an accent.
And you have an accent, yes. So you will get undermined. But what I have come to learn is you do not have the luxury of being mediocre. When you have a lot of things working against you, you have to make sure you know what you're talking about when you step in these rooms, because what you do not want to do is then to prove them right to say she didn't need to be here. So when you walk in these rooms and you're talking about stroke, you're talking about diabetes, you better know what you're talking about, and they will stop and they will listen. They will listen. And with time, they know. They will come and ask you, and they may act like they don't care, they don't respect you, but when it comes down to the important decisions, they will come and ask, Dr. Katema, what do you think about this? We had a meeting and this came up. What should we do? Dr. Thurman, they will come.
Excellent. Thank you, ladies.
Thank you.
Everybody watching, that's the website. Go there and you get all the information you need. This has been a great conversation away from elections and all the nonsense. And, I need to ask you this question before. Are you watching the World Cup?
A little bit.
A little bit.
Why a little bit? You're too busy.
A lot busy, but I've been reading about it.
Okay. I won't push the question any further. Thank you so much. I appreciate you taking the time, and we will definitely stay in touch and see what other stuff we can do together and make the healthcare systems help bridge this gap, and whatever we can do. Thank you, and have a great weekend.
Thank you.
Thank you
for
so
having us.
Excellent. Okay, everybody, that was Bridging the Healthcare Gap with Alpha 01 Medical Consultant Team. I hope you go to the website and get there. Next week, I'm going to have a fun show, okay? I'll be talking about the World Cup. So I've put a panel of nothing technical, nothing wah. We'll just be having fun, just looking at the World Cup. As the VAR worked for the World Cup, or it's making things worse. Those kind of things, that's what we are going to be talking about. I do appreciate you all for logging in and for your comments, those that are commenting. Please do me a favor. Let's make this go viral, not the crazy stuff people are talking about. These are the kind of things we need to make go viral, okay? I appreciate everybody. Thanks again. We'll see you next week. We'll be talking about FIFA 2026 World Cup. By the way, 9 out of the 10 African countries made it to the other round. It's going to be good. Bye.
Zambia Blog Talk Radio.